So I'm going to discuss the skeletal anatomy related to the greater occipital nerve block. As you would see here, this is the greater occipital protuberance. We have mastoid process and we have a C2 bifid process. The anatomy pertinent with regards to the greater occipital nerve block, there are two ways to do this block. You would put an ultrasound probe on the C2 and then you will move out and tilt the lateral end of the probe towards the mastoid process, looking for a muscle called obliquus capitis inferior muscle. And basically this is how the muscle is oriented, and it looks like a boat-shaped muscle on the ultrasound. The another way to do the procedure would be you feel for the mastoid process, and 1 finger breadth below the mastoid process you will position the ultrasound probe trying to aim towards the C2. And this is the same technique that you could do, which we will be able to find the greater occipital nerve in a matter of seconds, because your probe is now going to be oriented towards the obliquus capitis inferior muscle. I need to talk to you about the greater occipital nerve block with ultrasound guidance. There are two ways to scan the structure. One would be the midline technique to scan for the C2, moving the ultrasound probe from medial to lateral and aligning the lateral edge of the probe just 1 finger breadth below the mastoid process. The second technique is starting with the mastoid process, feel for the mastoid process, and 1 finger breadth below the mastoid process. If you align the lateral end of the probe, will give you a similar picture. We'll start to scan from the midline with the technique 1, where you'll be able to look for the midline structures, and you would see here this is the posterior part of the occiput, and I'm moving my ultrasound probe more quadad, looking for the bifid C2. Once you've seen the bifid C2 spinous process, your ultrasound probe will move more laterally and aiming towards the mastoid process, and in this image you'll be able to see multiple structures, and I'll freeze and show all of them. So we have a boat-shaped muscle, obliquus capitis inferior. We have another muscle on the top is semispinalis capitis. This is splenius capitis and trapezius muscle, and the structure that you see here is the occipital artery accompanied by the occipital nerve. To perform the injection, you could perform this with an outer plane technique, bringing the needle straight down into the plane between the obliquus capitis inferior and semispinalis capitis. The other way to perform this injection, you can bring the needle from medial to lateral, bringing the needle in the similar plane, in plane technique, and injecting local anesthetic and steroid mixture. 3 to 4 cc's of total volume of local anesthetic and the mixture of steroid, including dexamethasone or depomedrone, which should suffice for this block.